Chapter 1, The Anatomy of Medical Terminology. Today, we'll uncover the foundation of the language used in healthcare. Medical terminology is like the blueprint of medicine. It allows healthcare professionals to communicate clearly and precisely, ensuring patient safety and effective care. Let's start by breaking down some essential building blocks of medical terms. We have roots, prefixes, suffixes, which form the foundation of this language. A root is the core meaning of the word. Example, cardi in cardiology. Prefix is at the beginning, which alters the meaning. Example, hypo in hypodermis. Suffixes are at the end, defining function or condition. For example, itis in cystitis. You also have combining vowels and combining forms. Combining vowels link roots to suffixes or other roots with the O being formed which is the most common. Example, cardi or cardio in cardiology. Combining forms are roots combined with a vowel, like enter or entero. Let's get into more detail about the roots. Medical language has its origin in both Greek and Latin, which is why many terms may feel unfamiliar but highly systemic. At the heart of every medical term is the root, which provides the core meaning of the word. Roots can appear at the beginning, middle, or end of the term, offering flexibility in constructing medical language. When a root is combined with a vowel, often an O, it forms what we call a combining form, which makes it easier to attach to other elements like suffixes or additional roots. The combining vowel is an important part of medical terminology, even though it has no meaning on its own. Its primary role is to join word elements, making it possible to construct complex medical terms while also improving pronunciation. The letter O is by far the most commonly combining vowel, while others like A, I, and U are used less frequently, but serve the same purpose when needed. A combining form is created when a root is paired with a combining vowel. For example, in entero, enter is the root, and O is a combining vowel. And the slash separates the two for clarity. Many medical terms contain more than one root, and when that happens, the roots are always joined by a combining vowel for smooth pronunciation. For instance, in hemopneumothorax, we see multiple roots, hem for blood, pneum for air or lungs, and thorax for chest. These elements combine to describe a specific medical condition in precise detail. All right, let's do some elemental review. Let's break down the word gastroenterology to identify its elements step by step. Okay, so gastro or gaster is the first root meaning stomach. O is the combining vowel which helps connect the word phrase. Remember, O is the most commonly used combining vowel. Enter is the second root meaning intestine. O appears again as a combining vowel to ensure smooth pronunciation. Finally, logi is a suffix which means study of. Altogether, gastroenterology means the study of the stomach and intestine. Let's try a couple others. So you have gynecologist, right? You have gynec is the root meaning female. O is a combining valve helping to link the elements. Logist is the suffix meaning one who studies or specializes. Together, gynecologist means a specialist in the study of female health. Next one, cardiology. Cardio is the combining form where cardi means heart and O is the combining valve. Logi is the suffix meaning study of. Cardiology, therefore, means the study of the heart. Next, let's focus on suffixes, which come at the end. So, a suffix can attach to either a root or a combining form, and it changes the meaning of the term. When working with suffixes, the use of combining valve depends on first the letter of the suffix. If the suffix begins with a vowel, no combining vowel is needed. For example, hematoma, the suffix is oma, starts with a vowel, so the word is formed without adding a combining vowel. If the suffix begins with a consonant, a combining vowel is required to complete the term. For example, hematologist. The combining vowel O is added between the root hemata and suffix logist to make the word flow more smoothly. Occasionally, a word may even have two suffixes, further refining its meaning. Classification of suffixes. To better understand medical terms, it helps to categorize suffixes based on their functions. So let's break it up into 5 types. Diagnostic suffixes. These create terms related to diagnoses, procedures, or tests used to identify the nature of an illness. For example, biopsy uses a diagnostic suffix. Surgical suffixes, these describe invasive procedures performed on a body, for example, appendectomy, including the surgical suffix ectomy, meaning removal of. Pathological suffixes, these indicate symptoms or signs of a disease process. For example, cyanosis uses the suffix osis, meaning condition. Adjectival suffixes, these are 28 suffixes that mean pertaining to, such as airy in pulmonary, meaning pertaining to the lungs. And we'll learn a lot about those as we go through this course. You also have, lastly, noun suffixes. Some suffixes don't fit the other category, but turn the root or combining form into a noun, right? Like Isien or Ishien. In this case, physician means specialist. By understanding these categories, you'll find it much easier to decode and use medical terminology effectively. Let's do some more practice. So diagnostic practice here. All right. So we have hematoma and hematuria. Hemat is the root word for blood. Oma is the suffix for tumor or mass. So together, hematoma refers to a collection of blood in a tissue. Hematuria, again, hemat is the root word meaning blood. Urea is a suffix meaning urine. Combining hematuria, the combined hematuria means blood and urine. So by breaking down the terms this way, you can quickly understand their meaning and context in medical discussions. Here's some more. Surgical suffixes. Appendectomy, Append is the root word meaning appendix. Ectomy is the suffix meaning surgical removal. Together, appendectomy means surgical removal of the appendix. Lithotripsy. Litho is the combining form where lith means stone or calculus, and O is the combining valve. Tripsy is the suffix meaning crushing. Lithotripsy refers to the crushing of stones such as kidney stones in the ureter. By identifying these components, you can better understand how medical terminology describes specific procedures and conditions. Let's look at pathological suffixes. So you have cystitis. Cyst is the root word meaning bladder, though it can also mean cyst or stat or sac in other contexts. Itis is a suffix meaning inflammation. So together, cystitis means inflammation of the urinary bladder. Cyanosis. Cyan is the root word meaning dark blue. Osis is a suffix meaning abnormal condition. Cyanosis then refers to a dark blue coloration of blood due to lack of oxygen. Understanding these elements allow you to interpret complex term with clarity and precision. Adjectives. So here are some adjectives for you. These suffixes mean pertaining to. One thing you need to realize as you progress through this course and learn medical terminology for each body system, you'll notice that many suffixes are used to indicate pertaining to. In fact, there's about 28 of these suffixes that are very common in medical terminology. Here's three of them. Ac, airy, your. So cardiac, pertaining to the heart, pulmonary, pertaining to the lungs, posterior, pertaining to the back or the body, to the back of the body. These suffixes help specify the location or association of medical terms with different parts of the body, making it easier to understand their context. Lastly, let's look at the noun suffixes. Iatry, ishin, ickle. All right. As you continue to learn medical terminology in each body system, each chapter, you'll encounter suffixes that define specific roles or characteristics. Here are a few examples of suffixes that help clarify the meaning of the medical term. Psychiatry basically refers to as treatment or medical specialty. Pediatrician, expert specialist. Ickle, ossicle, small or minute. So in this case would be ossicle bones, the smallest bones in your body. All right. Now let's look at prefixes. Prefixes are essential part of medical terminology. A prefix is always found at the beginning of the medical term and modifies or enhances its meaning. Unlike other elements, a prefix never requires the use of a combining vowel to connect it to the root. For example, pericardium. Peri means around. Epicardium. Epi means upon. No combining vowels here are used. A prefix is always followed by a root word, which provides the core meaning of the term. By understanding the prefix, you can better interpret how medical terms describe location, time, and status. So clarification of prefixes. Prefixes in medical terminology can often be grouped into three main classifications, which make it easier to understand and remember. Prefix of position, prefix of number or measurement, prefix of direction. So prefix of position is referring to describing the location or position of something in relation to another structure. For example, epi means above or upon, as in epidermis. Prefixes of number or measurement. So this indicating some kind of quantity or size. For example, multi means many. So multipara or micro means small, as in microorganisms. Prefixes of direction, these describe movements or orientation. For instance, anti means before or forward, as in antepartum, or retro meaning behind or backward, as in retroperitoneal. By classifying prefixes this way, you can quickly identify their purpose and how they modify the root words they attach to. Let's practice some positional reflexes. Epidermis. Epi is a prefix above or over or upon. Dermis is a root word for skin. Together, epidermis is the top layer of the skin. Hypodermis, hypo is a prefix meaning below. Dermis is again the root meaning skin. Combined, hypodermis describes a tissue layer below the top layer of the skin. By identifying these elements, you can clearly understand the anatomical layer being referred to in the term. Here's for measurement. Multipara. Multi is a prefix for meaning many. Para is a root meaning for to bring forth. Multipara together describes a woman who has given birth at least twice. Primipara. Primi is referred to meaning first. Para is root word for meaning to bring forth. Combined, primipara refers to a woman who has given birth to the first time. For the first time. These examples highlight how prefixes modify the meaning of the root word to describe different scenarios. Let's look at directions. Anti-vert. So anti is the prefix meaning before, forward, or in front of. Vert is a root word meaning turned. Together, anti-vert means to tilt forward. Synapse. Syn is a prefix meaning come together. Apse is a root word meaning junction. In this context, referring to like nerve cells, which we'll talk about in later chapters. Combined, synapse referred to the junction between two nerve cells. By identifying the components of these terms, you can understand their precise meaning in medical terminology. Let's see. Oops. Element review. So let's just do some practice. So hypogastric. First, you have the prefix. Hypogastric is the prefix meaning below. Gastr is the root word meaning stomach. Ic is a suffix meaning pertaining to. In this case, for example, look, there's no combining valve is required because the suffix begins with a vowel instead of a consonant. Let's see. And one thing to look at too, also in medical terminology, there's going to be a lot of unique medical words. So these rules may not apply to every single terminology. So, for example, some terms are taken directly from Latin, Greek, or even Old English and have remained intact. These words often don't follow the usual structure of medical terminology, but are still widely used in both medicine and everyday language. So, for example, toxin, which means the word from the Greek word means poison. In Latin, medical means to heal. The Old English word record means to remember. Okay, so these don't necessarily follow the prefix, suffix, and root word rules, but again, they're still used in common language, everyday language, and also medicine. So, understanding these exceptions will help you recognize and use these terms appropriately, even when they don't fit in the typical pattern of medical word construction. Also, in medical terminology, precision is critical. Many terms are very similar in both spelling and pronunciation, but have completely different meanings. Miscommunication can lead to significant errors in healthcare, so it's essential to pay close attention to detail in both written and verbal communication. Here are a few examples. Ilium, pronounced ilium, refers to a bone in the pelvis. Ilium, pronounced in the same way, ilium, is a segment of the small intestine. Malleus referred to a small bone in the middle ear, whereas malleolus describes a bony protuberance at the ankle. These subtle differences emphasize the importance of accuracy when using medical terminology in order to ensure clear and effective communication among healthcare professionals.